Malaria is a major public health concern in Nigeria, with an estimated 68 million cases and 194,000 deaths due to the disease in 2021. According to the World Malaria Report 2024, Nigeria accounts for 27% of the global malaria cases and 31% of malaria-related deaths.
Ladies and gentlemen, thank you very much.
In a bid to curb the spread of malaria in Lagos, the state government is launching a pathway to malaria pre-elimination and digitalization program in partnership with other stakeholders in the health sector to improve case management and link patients to social health insurance schemes.
We know in the medical fraternity that there are myriads of causes of fever that can mimic malaria. So as a good professional environment, we need to be able to distinguish these categories and give the correct amount of treatment. One thing that we don't do much anymore is we don't examine our patients, so we're using this opportunity to advocate that we must do a thorough history and examine the patient.
About $20 billion has been set aside to deepen access to primary health care in Lagos State through the Impact Project set up by the federal government to also improve malaria prevention and treatment services.
For this year alone, for Lagos State, there's a $20 million earmark for these two components in Lagos State just for 2025. Earmark, I use the word earmark because you can only get it if you implement the activities. If activities are not implemented, that fund may not be available, so it needs to be implemented.
The World Health Organization and other partners are willing to support the Lagos State government to curb the spread of malaria.
We'll provide the technical expertise to ensure the successful execution of set objectives and contribute to the sustainable pathway for malaria pre-elimination while strengthening public-private sector collaboration for further improvement on malaria case management.
We believe that collaboration is the new innovation, and therefore collaborating with the private sector will be able to make a difference in this elimination process.
Right there at the event, the Lagos State Governor Babajide Sanwo-Olu, as well as the Minister of State for Health, were tested for malaria, thereby showcasing malaria control in Lagos State, a step commended by the federal government.
This momentous project will not only set the track for malaria pre-elimination in Lagos State, but in Nigeria at large, thereby once again making Lagos State a trailblazer.
Governor Sanwo-Olu insists all pharmaceuticals must test before treatment and prescription.
All of our pharmaceutical establishments ensure that we can pass this message. Test before treatment. It is so important that we do not just take this for granted. Let us ensure that we can take this advocacy into our communities, into our nooks and crannies.
The event was rounded off with the unveiling of Pathway to Malaria Pre-Elimination and Digitalization program in Lagos that advocates tests before treatment in order for patients to receive proper diagnosis for malaria.